So let me first of all start by introducing what is 190. This was initiated with the Indian grant in July 2016. Now it's a foundation established under the Act of Parliament. This is the government's pre-hospital care ambulance service. We operate under the Ministry of Primary Care, Epidemics and COVID Prevention, and also is managed by a board appointed by the President. Our mission, vision, tagline, everything points to only one, that is save a life. So all our focuses, everything is on saving a life, whether it's on the road, home, on the field, or anywhere. And also, we have only a very limited time to get to you, treat you, stabilize you, and take you to the nearest suitable hospital. We have 297 ambulances covering the whole island. We we get about 5,300 calls per day. And out of that, 98.9% of the calls are answered in the first ring. And we do about 1,050 plus cases generally on a normal day. But these days with the COVID, the case count has gone up. Now you might ask why there's a gap between the number of calls and the number of incidents. That is because we get a lot of multiple calls. And our average response time in the country is about 11 minutes 40 seconds, but in Colombo, it's about 8.5 minutes. As of this morning, we have received about 3.9 million calls from inception, and we have handled about 847,000 emergencies. This is the country map, the coverage map. You'll see that other than the jungles, we basically cover all the whole country. We have a fully equipped ambulance with different type of stretchers, medical equipment, and medical consumables. Now I'll move on to the heart of this operation, that is the Emergency Command and Control Center. Now, beginning with all vehicles are fitted with GPS with near real-time positioning. We are also integrated with Google Traffic. Now, a call to real-time is something that when we assign a case to an ambulance, they have only 1.5 minutes to start the engine, get moving. Now, the ambulances are generally parked at police stations. So move out of the police station and hit 10 kilometers an hour, which is a small time. At small speed, but then we know that the team has started moving. In 2.5 minutes from the time we assign, if the ambulance has not moved, the system alerts back to the call center because they might need to de-assign and reassign to another ambulance because they might be having a problem. Also, all our movements of the ambulance, either they had to have a case ID, movement ID, or a maintenance ID. If not, it alerts the call center to check why the ambulance is moving without a valid ID. Now, when you call 190, this is the emergency dispatch officer screen. We will have your number. We will ask for your district, your city, and a location. We don't need the full address at the beginning because we want to know at the beginning, from the time we get out of the police station, turn left or turn right. We'll ask for your emergency, and the system will show us the fastest ambulance, not the nearest, because nearest will not always be the fastest. This is because we are integrated with Google Traffic. And after the ambulance is dispatched, we will take the balance data from the patient party. Similarly, you can call us through our app. The app will transmit us the GPS location. This app is available outside the country also, especially for tourists. When you land, you know there is an ambulance service free of charge in an emergency that can take you to a hospital. Now, when we get the call from the app, the call center agent knows that it's coming from the app. We have your location. All what you need to ask is at the beginning only two questions. What is the type of emergency, and select the ambulance and dispatch it. Now, this is very valuable because Colombo, we have most of the addresses, but outstation, a lot of the addresses are missing on Google Maps. Now, the moment we dispatch, The data is sent to the ambulance, which we call the navigator. It's a tab. The navigator will show the direction to go for the ambulance driver. We call the ambulance driver a pilot because he's a semi-trained emergency medical technician as well. Now, on the navigator, they have some more buttons like when they reach the patient location, they have to press a button because that will create as a secondary database of all the addresses in the country. The emergency medical technician will call the doctor, inspect the patient and call the doctor who's in the call center. There's a team of doctors 24/7 in the call center. The doctor will advise the emergency medical technician after receiving the incident information from the emergency medical technician what to do, and also the doctor will decide the type of hospital that the patient needs to be taken depending on the illness. Now, I think most of your with a technological background, we use quite a bit of geofencing so that when the ambulance arrives at the hospital and departs, all those things are recorded. Similarly, because they are parked at police stations, when they reach the police station, and also sometimes you need additional cleaning time. So again, that also can be called from the navigator. Now, sometimes what happens is when you go to a hospital, uh, there's a handover issue. So what we have done is we have taken the last 6 months on each and every hospital handover times, and we what we do is depending on the handover time we add another 5 minutes. So for example, if it's 20 minutes, then 25 minutes, the call center will call the ambulance team and ask, look, do you have a problem and do you want the call center or a senior person to get involved? So this helps us to make sure that everything is in the move and happening. Now we have a 119 support officer also in the call center. Now 119 is the Sri Lankan emergency police number. So when we select on the system, motor vehicle accident, assault, automatically that data goes on to this officer's screen, who's also in the call center. He will either phone or radio the specific required police station. He'll write on his book and he will update our system again. So one fine day when the police system is also up and running, we don't need to have this person. We can directly link to the that specific police station. Inventory management is also on a system where we now each and every ambulance will not need all the medicine in bulk quantities. Depending on their requirement, we have minimum quantity requirements. Depending on the average number of cases they do, the inventory management system is set up in a way where we will minimize unnecessary expiry items. The ambulance is fitted with dash cams as well as patient cabin cams. These are not connected at the moment. What we do is manually transfer that data on a regular basis to the head office. Now, unlike managing one single office, you have to understand that we have 297 locations around the country. So we have to manage attendance and administration as well. So we use a app for that. They need to take their photograph and their location, everything gets locked in. Also, with the new COVID situation, they need to take the temperature also and enter onto it. And also, if there are any admin messages, that also goes onto the system where they can read and acknowledge that they are ready. At the moment, we are going through a change in the system where we are integrating facial recognition onto the system. Now, apart from that, even the field staff, that is the district officers, fleet team, and the audit team, for them to reduce their documentation, we use another app where their movements, to do issue findings, all those things are entered on the system. Now, for fuel monitoring, this is a common issue where most of the Sri Lankan government officers are facing. We use the app and a pay card. So there's a protocol where when the ambulance arrives at the fuel station, they need to take the photographs of the dashboard, the fuel meter, and enter the digits. And as well as when they finish, they need to take another 2 photographs and upload onto the app. Also, when they swipe the card, the SMS comes onto our system with the data that they have entered and the backward calculation. We know the KMPL for each and every refueling. If there's an issue, it gets escalated to the fleet team to check on it. Also, we do not do a separate trip for fueling. What we do is on the way from hospital after a case, that is the only time we do a refueling. But the minimum standard is 75% full tank. The district officers, they also have their own app where they can see what's happening, ambulance, whether ambulance needs maintenance, etc. Now, the EMT, emergency medical technician who's in the ambulance, the moment they finish a case and when they're leaving out of the hospital, they need to enter certain details to finish the case. Now, during the pandemic, the government of Sri Lanka introduced the 1390 hotline. Now, during the pandemic, something else we experienced was our call load increase. So if they need an ambulance for them to call us and request for ambulance, it is going to increase our call load as well. So what we agreed with them was through an API, they were pushing that emergency data to our system, and our system popped up to an agent to dispatch an emergency ambulance. Failover and DR is also very serious. Now, from the side of the ambulance, we everything from the GPS, phone connection, everything has multiple connections and failovers. Now, from the call center side, every 3 months we have a failover drill. Either the IT system or the 1990 number, which is on fiber, sometimes that also fails. So the agreement we have got with the telco, in the event of a fiber failure, they push the calls automatically to the copper lines. And our team goes on to whiteboards, pens, mobile phones to make sure that not a single life is lost. Now with the Easter attack, we further improved our system where the clouds, we have moved our DR to the cloud, and also with the telco's agreement, we can forward it to any number in a different way where it goes on hunting, and ultimately anybody can work from home and answer emergency calls. Now with the pandemic, since we are ready with that, with the pandemic, we purposely keep one team home, one call center team home, and make them work from home. So that way they are also getting ready how to work from home. In an emergency, we had to shut down our head office call center due to some pandemic issue. The hospital alert system is also, the backend is ready, and any hospital who wants the dashboard, we are ready to provide, which will give them the ETA, the patient incoming, everything. For floods and tsunamis, we can't call in one go for 297 locations. So we have divided into groups, and we have marked safe locations and geofenced as well. So the moment that particular ambulance goes on to that area, the system automatically shows us that the ambulance is in a safe zone. Now, coming on to future improvements. If you could remember the Beirut explosion, what happened? The first responders team went in thinking it was a fire. Then the second blast came in. Now, this is a common thing that could happen anywhere. So now it's on the POC stage. We discuss with the disaster management. When we get a call for a fire or explosion, when you select that, and enter the address, automatically it'll check with the disaster management center's database, which they have all the location that is storing chemicals or explosives. With that only we move the ambulance to the directly into the scene until we get that approval. They have to be outside, because if it's explosive zone, then we need to inform the CBRN and then get their approval to move in. Now, the patient care report, which is a manual one for the time being, we are in the process of making it a digital form with the tab and a mobile printer. So they will print it, give the hospital copy, and get the other copy signed for our own records. With the e-PCR coming in, we are going to bring in the analytics as well. We are cross-checking whether they have used the proper equipment depending on the case, whether they are given the proper medicine according to the doctor's instructions. These things happen now, but in a manual way. But with the analytics engine coming in, all those things will be automated, and the quality team will have better things to do other than checking whether we have done the case properly. Now, this is something we are trying to implement, is the RF network. So in a failure of all the mobile networks, we will have our RF network working. Then this is also in a POC stage where we are trying to bring in all the camera feeds into the call center, and also the patient monitor details, the ECG details, because for a cardiac case, when they send the details to our doctor who's in the call center, he will decide whether this needs to go into a cath lab or not. If he decides yes, using another app which is integrated, they will forward it to the on-duty cath lab doctors. They will decide, these are the cardiologists, they will decide whether they want the patient and whether they are free. If they are free and they feel that this person needs to be brought in, the doctor instructs the ambulance to move on to the available cath lab, depending on the request from the cath lab side. Now, we have to remember generally we have only 1 hour to do all this. And also the glass as well, so that the doctor can see what is happening at the patient location. Now, this is something that we are doing together with Slintech and Biman, where a wearable fall detection device. Now, one thing is for elderly people. I'm not going to go into detail, probably Biman will do during the discussion time. And also, if you are driving a vehicle and if there's a sudden shock, the watch will send us the alert details for us to follow up and call you and ask. Now, last Saturday, we had an incident at 2 o'clock in the morning. We got a call from the hill country. While he said he has met with an accident on the bike, and he just gave a location closer to a hotel, and his phone died. So we had to use 3 ambulances, basically sweep the whole area where he said for 3.5 hours to find this person. If he had been wearing the watch, finding him would have been just 5 to 10 minutes. My presentation will not be completed if I don't talk about the continuous training we do. We do quite a bit of training with the CBRN units, Army, Air Force, and the disaster management teams. And also, after the initial training for our EMTs, where we send them to India, they go through refresher trainings every month with our doctors. And apart from that, Australia and New Zealand College of Paramedics, they come down every 6 months to conduct refresher trainings, which they come and conduct free of charge. Apart from the skills training, lifting, carrying, moving a patient, handling a patient, this training is also given to our staff every 6 months. This is something very important, the daily practices that they do. These practices are recorded by the ambulance camera, and they send it to the quality department and the training department for further analysis, and for them they will know whether they need additional training or not. Lifting, carrying, moving, handling a patient is very important because for us every second matters. So if you are fully practiced of even using the stretcher, loading the patient, handling the patient, we save valuable seconds. Finally, all these systems, training, nothing will be useful if not for these 1,394 young males and females who are committed to their job, but not as a job, but a service to the nation. Thank you. One more thing, sorry, the challenges we have every morning when our team starts work, what we think is we wonder, have we done enough not to miss even a single life falling through our fingers. So we know we can't save every life, but we are trying our maximum to save maximum amount of lives. Thank you.